Hello guys, good day. So discuss natin today how is quality control implemented in hematology. So we will begin in micro and macro sampling, tapos in automation. Okay, so we will just discuss a little bit of quality control among the pre-analytical, analytical, and post-analytical phases of your hematology section. Okay, so simulan natin. So guys, one of the departments that is most overlooked na hindi masyadong nadi-discuss in college is the value of the reception department. Okay, so usually, guys, medtech talaga ang nagmaman doon or laboratory technician or usually in regional hospitals, government hospitals, mga plantilla, usually mga job orders ang nasa receptionist. But guys, their work is equally important with those who are working inside the laboratory, okay? Kasi they are in the pre-analytical phase and, di ba? Pre-analytical phase, analytical phase, and post-analytical phase, walang mas hihigit sa tatlo. The three of them are equally important, okay? So today, and I won't go into very much details, the technical steps, pero I'll just emphasize on the things that sometimes you overlook, okay? So first one is patient identification talaga ang first slide. Because it is the number one common error, guys, in specimen collection. Okay? So, kailangan ma-emphasize to. So, allowing the patient to completely state their name talaga. Buong pangalan sometimes, not only the last names. Because, especially, baka kaka-relative sila. Okay? So, pediatric patient, burn patient, yan. So we have to ask the nurses and physician. So guys, maganda rin talaga na example, the patient was admitted and you're the one who's going to extract, always drop by the nurse station to inform them that you're going to extract blood from a certain patient, because sometimes they will give you a heads up of the precautionary measures. Baka sabihin nila, ma'am, HIV patient pala yan, be careful. O kaya, ma'am, please wear a N95 because may TB yung pasyente. So guys, that's a good practice. Always drop by the nurse station and inform them who is the patient that you're going to extract. And after extracting blood from the patient, pag aalis ka na, inform them that you are done as well. Yan. So, ganun, guys. So here are the 10 reasons for errors in specimen collection. Okay, screenshot na lang sa Henry's to. Okay, so mislabeling, short draws, ito minsan. Some students are so focused in getting the blood inside the hub, pero underfilled or overfilled naman. So hemolysis, mixing, processing errors, delays, exposure to light, kunyari bilirubin kung mag-expose sa light. Kailangan transport in ice or in ice lagi yung mga arterial blood gas and so on. So let's begin with microsampling. Okay, so guys, microsampling, hindi mo mawala sa laboratory yan. It is a need in the laboratory. Because there are just some people, you don't need to get a lot of volume of blood, okay? Especially among newborns up to 6 age, after 6 months of age, yan. So, ayaw mo naman kuha ng masyadong maraming blood sample, young children, and adults with difficult veins. Example, mga chemotherapy patient, mga obese patient, mga patient with a lot of IV already in their arms, burnt patients. Yan, huwag na rin pahirapan sila, huwag mo na rin pahirapin yung sarili mo, mag-microsample ka na, okay? So, back then, yung mga gunshot wound patient namin, yan, baril na nga, so you don't need to get a lot of volume of blood. They're losing blood already. So, where are the sites of puncture? So, among neonates, yan, sa lateral plantar surface of the heel. Yan, lateral and medial. So lateral dito sa tapat ng small toe, smallest toe, medial sa tapat ng biggest toe. Mas recommended guys ang lateral area because it has no arteries. Dito kasi may tibial artery. And older children, yan, naglalakad na, you could extract already on the third or the fourth finger or the margin of the earlobe, which is I never tried. So for microsampling, expect that it's a mixture of capillary blood, arterial blood, and venous blood. Okay, so medyo ano siya, diluted siya. Okay, so medyo mas mababa yung hemoglobin, hematocrit, and platelet. However, expect increased amounts of WBC. Ayan. So guys, yan, ito yung suggested na prick on the perpendicular of the fingerprints, okay? Para mas there will be a more smooth flow of blood. Yan, pag kasi minsan makalat, pag you will go, you will follow the fingerprints of the child. However, sometimes, di ba, tantrums na, basta ang main goal, matusok, which is okay, no problem naman, okay? But, yan, if kung kalma naman yung patient, yan, make sure na perpendicular yung pagtusok mo. So, sites to be avoided, yan, inflamed and pallor areas. So, if it's already red, huwag mo na tusukin, friend, okay? So, for cold and cyanotic areas, expect that there is high hemoglobin in these areas. In areas where there is congestion and edematous increase accumulation of fluid. Yan. So, fluid makukuha mo dun, hindi capillary blood, okay? So, don't get there. And scarred and heavily calloused areas, talagang hindi nyo maiiwasan guys, may mga pasyente kayong mekaniko, mga heavy equipment, mga laborer guys, in working in the construction, sometimes ang dumi pa ng mga daliri nila, insan talaga ang callous talaga. So, those are the things that you just will expect in practice. So, errors usually come from sampling. So sometimes hindi masyadong malalim yung pagtusok ng lancet, or sometimes the lancet is just so small for microsampling, excessive massage, and excessive drying. Sometimes yan, guys, tinusok mo, alam mo, okay, pumasok talaga yung needle. You know, just wiping the area could free again the flow of blood. Okay? Kung alam mong pumasok naman yung buong needle. So, yun, sometimes errors happen if the puncture is too shallow. So, here now, let's go to your macro sampling na guys, or your venipuncture. So, syringe method, open system and closed system is the vacutainer method. You know, class, ako, nung intern ako, parang, bakit may syringe method ba? Hindi pa dapat vacutainer na tayo. But, you know, syringe method is very accessible, especially the gauges of the needles. If you want to change from the highest gauge to the lowest gauge, yung talagang pang malinipis na ugat, available yung mga needles. Unlike your vacutainer method that sometimes the vacutainers available are only green or blue. Yan, 20, 21 gauge lang available. So sometimes in times where the veins are so small, yan, mas okay na needle. Needle syringe method ang gamitin or butterfly method kung meron. Yan, so arterial puncture, so usually the purpose of arterial puncture is for arterial blood gas. Yan, so ang gumagawa nito guys are respiratory therapists. And yun, when I was working in the hospital, there was no respiratory therapist, and the medtechs were the one performing arterial puncture. We were the one processing the arterial blood gas. Yan, so Ito, pag arterial puncture, what you puncture are the pulse sites. So pulse sites in the radial area, in the brachial area, and the femoral sa singit. So the angle of extraction is quite high, 45 to 60. Unlike your syringe method, Bucketiner method, mga 15 degrees lang. And femoral talaga, straight. Papasok. Yan, kasi ang lalim talaga ng femoral artery. Yan. So, I tried extracting in the femoral artery. So, pag arterial puncture, guys, walang tourniquet. Okay? So, syempre, pag femoral, saan ka maglalagay ng tourniquet? Alangan na sa, di ba? Sa torso. Yan. No need for tourniquet when it's arterial puncture. So, ayun, guys, malalim talaga sa femoral artery. So, kailangan mo hawiin yung pubic hair. Of course, there's pubic hair. And yan, you have to palpate where the pulse is, and it's very deep. So, pediatric collection, yun, the gauge is 23 gauge, mataas, yan, para manipis. So, syringe method, available yung mga needles, Vacutainer, sometimes not. So, guys, in quality control, watch out for the quality, for the cleanliness of your tourniquet, yung aseptic, antiseptic solution mo, baka evaporated na, di ba? So, I mean, guys, it starts with a good quality equipment, okay? Sa para smooth yung flow ng procedure mo. So, meron nga sa Facebook, it was trending na may isang vaccinator, tinusok yung needle sa arm ng pasyente, hindi ito pumapasok. Sabi ng vaccinator, nakulbot. Yan, matigas daw, makunat yung skin ng tao. Of course, that's not the problem of the skin. The problem was the sharpness of the needle, the quality of the needle. So, hindi pumapasok kasi yung needle, mapurol, guys. So, you have to assess, you have to get good quality needles or vacutainers. Yan. Sa amin na, Terumo. Yan, maganda. Pag Terumo, other brands parang hindi okay. Tapos may mga vacutainer tube pa dati, guys, na parang mababa yung pressure nila. So, ibig sabihin, hindi quality yung binibenta nilang vacutainer. So, you have to find a good supplier as well. Yan, linisin nyo yung tourniquet nyo. So, yan. So, advantages of Venipuncture. So many advantages. Yan. So, it could be mail, it could be transported, especially if there is back then, measles. So, pag may testing sa measles, you have to report it to DOH. Kailangan mo rin sila bigyan ng blood sample. Yung mga confirmatory test for HIV, you have to send it to San Lazaro Hospital. Yan. So, you could transport samples that were from a venipuncture. Hindi mo pwedeng mag-transport ng capillary tubes. Disadvantage is there are more complications in venipuncture. So, guys, diba, you have to watch out for complications. Okay? Tignan nyo sa mata yung mga pasyente nyo. After venipuncture, yun, stay a while and observe your patient. So, where are the sites of collection? So, for newborns up to 18 months, yan. So, mga 1 year, 6 months, these are the area where you could extract sa mga longitudinal sinus vein, external jugular vein, and temporal vein dito. So, usually, mga pediatric residents ang gumagawa nito. Sites of collection, if 18 months or 3 years older, femoral, the vein, saphenous vein, ankle, the ankle, na nakakita na ako ng ganito, popliteal, sa likod ng knee, kung di ako nagkakamali, extrajugular vein and temporal vein. 3 years old and above, you could now extract on the antecubital fossa vein, dorsal of the hand and foot. So, ayan, guys, yan, I'm hoping na memorize nyo na. So, the most stable and well anchored is the cubital vein. Cephalic vein, good for obese patients. Basilic vein, it tends to roll. Yan. However, talagang laki naman kasi ng basilic vein eh. Ayun, however, yan, may katabi siyang nerve, artery. And you can collect, guys, yan, depending on the patient, di ba? And huwag kayo magko-collect sa mga tawag doon, yung mga spidery veins, varicose veins, wala kayong makukolekta sa varicose veins. I tried extracting on varicose veins, walang lumalabas. Yan, so be careful lang sa foot extraction, di ba? Sa mga diabetes patients. Tsaka sa mga old people. Yan, kailangan i-anchor mo ng maayos pag nag-extract ka sa hand and foot. So, general steps on venipuncture. We have patient identification. Yan, ito, isolation restrictions. You have to be careful. You have to protect yourself and you have to protect other people. Okay, so yung mga COVID wards, ang alam ko, yan, pag sa COVID ward, yung lahat ng COVID ward, yung pag may nag-extract ng blood doon, yan, kung sino yung naka-assign doon, sa COVID ward lang talaga siya. Yan, note the dietary restrictions. Yan, huwag tayo extract ng extract. So, sorry. Ask if they fasted, if there's the need for fasting. Yan, to guys. Yan, reassure your patient, okay? So, alam natin, sanay na kayo makakita ng dugo, tusok ng tusok. However, we don't know that some patients really have trauma when it comes to blood extraction. Yan. So, reassure them, okay, that it's going to be okay. Position the patient. Yan. So, positioning the patient, it's not only for the patient, but it's for you, hindi ba? So, please check every time that you're going to extract, bantayan nyo yung likod nyo, yung leeg nyo, that you guys are also comfortable, okay? So, hindi tayo martir. What if 50 people extractan mo, tapos every time you're going to extract, strained yung leeg mo, yung shoulders mo, yung likod mo, you have an ugly posture every time you're going to extract. It will ruin your back in the long run. Okay? So, watch your back. Literally. Yan. Select the correct venipuncture location based on the patient. Okay? Case-to-case basis yan. Assemble the supplies. Make sure that it's complete. Yan. Basahin mo yung requisition form kung ano ba yung mga tubes na kailangan. Apply the tourniquet, tense the site, inspect your needle, make sure bevel up, matulis, perform the venipuncture, release the tourniquet, withdraw, and apply pressure. Sorry. Yan, apply the pressure, guys. So, para naman mabawasan yung chances of forming a hematoma. And post-phlebotomy procedure. So, proper disposal. So, dapat neat naman kayo. Yan, label and check your patient. Assess kung okay lang ba sila tignan nyo sa mata. Okay, yan. So, please ensure that your evacuated tubes are properly placed. Sometimes, hindi pumapasok yung dugo kasi nakatakip yung hub or yung, I forgot this term, yan, yung rubber tubing. So, yeah, just correctly place it. Sometimes, just moving it a little bit will fix the flow of blood. Yan. So, proper needle position, yan. Case-to-case basis rin yan. Yan. So, based on experience, yan, memorize nyo rin yan how to insert the needle. Ito guys, how to place the tourniquet. Yan, make sure nyo naman parang regalo yung braso ng pasyente nyo. Hindi parang, may tinaling pata ng baboy. Yan, yung sobrang sikip na sikip. So, wrap it just like a gift, okay? Yung saktong comfortable naman yung pasyente nyo. So these are the common anticoagulants used in the laboratory. For peripheral blood smear, for CBC, EDTA ang gamit natin. For heparin, osmotic fragility test, some staining methods, kailangan heparin. And sodium citrate for coagulation test, yung prothrombin time, activated partial thrombin time, APTT and PT, sodium citrate ang ginagamit. Okay? So please watch out for the order of draw. So mauna ang citrate, tapos EDTA, tapos heparin. Tama ba ko? So guys, for the reminders lang, okay? So if your tube is underfilled, especially if it's EDTA, what could happen is it could shrink your blood cells, okay? Pwede siyang mag-shrink pag excess yung EDTA mo. Pag insufficient naman, masyadong maraming blood, konti yung anticoagulant, there could be clotting. Yan. So, you could use your EDTA for your WBC count up to 24 hours if EDTA was stored at refrigerator temperature. However, kung hindi naman, yan, recollect na lang tayo, okay? And smears could be derived from your EDTA within 2 to 3 hours. More than that, recollect na lang. So please take note of the specimen rejection, di ba? Sayang ang effort, sayang ang time kung mare-reject rin ang specimen. So check it well, di ba? So improper collection tube, hemolysis, lipemia, you did not store your blood gas and ice. So here, papunta na tayo sa automation. So this processing, yan, these tests are important, okay? Kasi ito yung purpose ng hematology department natin or section. So if ever you're going to use so for the pipettes and hemocytometers, so usually guys, ginagamit ito sa, mas common na to sa sperm count, sa body fluid, cell count ng mga body fluid, not or hindi na masyado sa hematology unless siguro brown out talaga. So, however, you have to check yan, if your pipette and hemocytometer is still functioning. Check if there are clots. Yan. Check your dilution well, your computation dilution, and use controls. Yan. Sige, mag-proceed na tayo sa automation. So, our best friend in hematology is your hematology analyzer, okay? Pag nag-bug down to, magmamanual ka, okay? So, you have to take care of them. So, before starting your shift in the morning, yan, dapat lahat ng AM shift, ito ginagawa nila, okay? So, it should be on. Yan, hindi na dapat ino-off. So, clear the load list. So, example, yung mga name ng patients andun. So, you could clear it. So, to start the day again. Yan. And what else? Yan. So, you could do a priming procedure. Yan. Kumbaga, i-clean. Yan, priming. So, usually, every shift ginagawa to, every 8 hours pwede gawin. Or every 24 hours. Okay, priming procedure. What's the purpose? To remove all the samples and reagent residues in the tubings. Yan. What else? You have to clean the surfaces of your instrument, guys. Tingnan nyo naman yung ginagamit nyo, baka alikabok na. Yan, wag nyo namang hayaan rin na mapuno ng alikabok. Guys, look at your laptop. Yan. Baka puro alikabok. Yan. Patikimin nyo naman ng wipes. Here sa makita natin, gauze with 10% bleach solution, then rinse with distilled water, then clean also the reagent vessels. So, kung saan nakalagay, nasa loob kasing reagent vessels eh. Saan nakalagay, pwedeng palitan, pwedeng linisin. Weekly schedule. So, we also have waste line cleaning. Okay, so once your mind ray will suck the blood, so magko-combine yan with the reagents, tapos it has a line. It has a tubing for the waste products. Yan. So, yan, kini-clean yan every week. You could also clean the halogen lamp optic sensors. Depending on the technician ha. So, sa na-search ko, every week daw to. And the needle cleaning, yan. To remove the proteins from your EBTA tubes. So let's get to know your analyzers further, okay? So your analyzers could have two classic methods. Either it would have electric impedance or electric resistance or Coulter principle. And or yung mga equipment, we call it a Coulter counter. At merong light. Yung isa electric, yung isa light. So optical detection or light scattering. So for electric impedance, the principle is that we have this fluid wherein the electronic field, guys, pass through it. Yan. So may electricity yung solution na to. And there's just consistent electrical flow that pass through it. Guys, once your cells will pass through the detector, it will resist the flow of electric current. Kumbaga, pipigilan niya, it will impede. So, if this is the flow of electric current, guys, pag may dumaan na na cell, titigil yung electric flow. At every time, guys, natitigil yung electrical flow, it will be measured as a pulse. Yan, pulse. So, the number of pulse, yan, kung ilang beses tumigil yung electrical flow, that is the number of cells that pass through the detector, okay? And the pulse size will determine the size of the cell. So, if the pulse size is big, malaki yung cell na dumaan. If the pulse size, either kunyari, platelet lang dumaan, yan, maliit lang yung pulse size. Pero pag kunyari, monocyte dumaan, yan, mas malaki yung pulse size. So, yan, electrical impedance. So, your cells could not conduct electricity. So, it impedes or resists electricity. So, every time it resists electricity, it is counted by your machine. We have light scattering, so the ability of your cells to scatter light. Yan. So yung una, electric. Yung isa, ability to scatter light. So laser yung ginagamit dito. Yan. So for electric impedance yun. So cells are poor conductors of electricity. So every time they will pass through, it will be detected because of its resistance. You know? Yan. So depending on the size of the cell, it will create a pulse. The voltage number will determine the number of cells. The amplitude, kung gaano kalakas yung pulse, will detect what type of cell. So compared to leukocyte, tingnan mo naman, ang laki ng pulse compared to platelets and erythrocytes. Okay? However, yun yung mahirap, guys. Example, if there are giant platelets, yan, it could be counted as leukocytes. Yan. So it could affect your results. Ayun. So yun yung mahirap, guys, sa mga hematology analyzer. Example, may nucleated RBC, it could be counted as a leukocyte. Yan. Because it does not detect the internal structure, it just detect the size, based on size. Yan. So we also have light scattering. Yan. So how the cells would scatter light. Yan. The laser light. So either, yan. So pag yung light scatter niya pataas, may photodetector dito. Dito sa medyo mababang angle, may photodetector rin. Okay? So the right or high angle, yan. So once it scatters the light, yan, tapos high angle, it will detect the internal structure. So the number of nucleus, the granules of the cell. So, mas precise ang light scattering technique. Now, the forward or low angle light scatter will measure the size and the volume. Okay? So, yung light na nag-scatter sa taas, it will detect the internal structures. The lower angle will detect the size and the volume. The number of pulses will determine the cell count. So guys, mataas ang dilution ng mga hematology analyzer. 1:500 and 1:50,000 sa RBC. Notice guys, sa kung alala nyo sa hemocytometer, 1:10 lang ang WBC, 1:100 lang ang RBC. So, ang taas ng dilution sa hematology analyzer. And one way, guys, to identify the different WBCs in the hematology analyzer are your cytograms and histograms. Yeah. So, in a histogram, what you will see is an X and Y axis. Sa X-axis, makikita yung cell size and volume usually in femtoliters, yung unit and frequency. So, ibig sabihin, pag ito, yan, mataas, ibig sabihin, mataas yung amount, okay? So, dito 5 to 20, I'm guessing this is platelet. Yan. So, it would show the platelet. So, ayan guys, you could see magandang histogram kasi pag nakita mo na tong histogram, you would know yan, what are the cells present, if there is abnormal increase of that certain cell, and so on. Yan, napaka-familiar nitong makina na to. Parang ginamit ko to ng internship ko. So, tingnan natin, guys. WBC4, yan. Medyo mababa. 5 to 10 ang normal ng, yan, low nga, oh. 5 to 10 ang lower ng WBC. So, medyo mababa siya sa x-axis, sa y-axis, okay? Normal naman yung lymphocyte, mga mid na sizes na granulocytes and granulocytes and lymphocytes. Hindi ko alam itong mid. Yan. Na mid na to. However, yan, this WBC, yan, shows a normal curve, okay? Pero yung height, hindi normal kasi medyo low yung numbers. For your red blood cells, guys, low yung hematocrit, yung hemoglobin, yan. However, the size is normal. Kasi ang normal size, itong MCV, it will show the volume. Ang normal volume, guys, 80 to 100. So, around normal shape yung mga red blood cell natin. Pero since mataas tong MCH and MCHC, yan, medyo mataas yung hemoglobin nila. Pero yan, that's not a problem. Your platelets is kinda low. Yan, medyo mababa siya. Yun lang naman. So, all in all, the histograms looks close to normal. I'll give you more examples. Kung 80 to 100, itong baseline natin, ang red blood cell, yung femtoliter nila. So, 90 to 160 ang monocytes, promyelocytes. These are big cells. Granulocytes, guys, are bigger. 160 to 450. And so, dito sila nagpo-fall sa dulo ng histogram. So, this is an example of histogram. So, this is the lymphocytes. These are where your monocytes, basophils are, and neutrophil. So, dito sa image na to, there is neutrophilia. So, expect na may spike dito sa area na to. There is lymphocytosis. Yan. So, mataas. So, medyo mukhang pareho sila. Yan. Mataas yung lymphocytes. Monocytosis. Yan. Mataas yung dito sa gitna. Eosinophilia. Mataas na rin sa gitna. Yun. So, by looking at the histogram, it could give you markers if there is increase or decrease on the blood cells. Yan. So, for the double RBC histogram, yan, ito yung range 36 to 360. Malawak ng range. Your MCV, your volume, and your RDW are derived. So, We get it directly from the measurement of the machine. However, guys, ang hematocrit, ano to kailangan mo ng centrifuge. So, walang centrifuge sa loob ng hematology analyzer natin. So, what they do is inside the machine, they just multiply, okay? And also, your MCHC, they are calculated only. So, this is an example photo of a smear, guys, which has increased RDW or red blood cell distribution width. Guys, ang normal value ng red blood cell distribution width is about 11%. Pag lumampas sa 11% ang RDW, it could be a sign of anisocytosis or poikilocytosis. Or ibig sabihin, dimorphic population, iba-iba yung size. Pag yung RDW mo, guys, 10% lang, expect na pare-pareho yung itsura ng mga red blood cells mo. Pero pag lumampas, ito, 12.6%, it could show a low anisocytosis. Ibig sabihin, there is a slight variation in the size. If there is high RDW, so there could be more extreme anisocytosis. Yan. So ito, baka RDW nito, mga 16% pa rin. Yun, so just looking at the RDW, alam mo na kung anong may expect mo sa blood smear. And also platelet histogram yan. Because yun nga, sometimes may normal size platelets, may giant platelets. So looking at the histogram will guide you what are the shapes of the platelet. We also have scattergrams. Yan. Maganda to Mas I think this is more accurate on where does your cells lie. Yan, maganda rin to. Parang histogram rin siya. Cytogram, yan. Isa maganda sa cytogram, it uses staining. So usually when we use stain, you become more specific Because, example, only basophils could be stained in ASEAN blue or toluidine blue, lipase esterase monocytes, peroxidase, mga polymononuclear cells. So, good rin. Yan. So, guys, ito, just take note kasi we will learn about the sources of error in analyzers. So, ang hemoglobin natin in the machine, the machine measures the hemoglobin through cyan-methemoglobin principle. The cyan-methemoglobin principle uses a spectrophotometer. So, the dilution or how dark or how light the solution becomes, pwedeng it could affect hemoglobin. Okay, example, in cases of lipemia, lipemic yung milky yung EDTA tube na pinasak natin sa analyzer, it could produce a falsely high hemoglobin result. Kasi nga, it uses a spectrophotometer. Yan. So, hematocrit, it's just calculated. Okay? So, kung tumaas yung hemoglobin, hematocrit is measured through using hemoglobin So, pwedeng tumaas rin yung hematocrit since it's calculated. Ito na. Example. Ito. WBCs over 50,000. This is a lot of WBCs. So, it could make your EDTA blood turbid. So, it could affect your RBC count, hemoglobin count, and hematocrit count, and indices. Yan. So, what could we do? Kung masyadong turbid yung solution natin, we could now dilute. Okay? And perform a manual hematocrit. Tayo mismo ang kumuha sa capillary tube tapos paikutin sa microcentrifuge tube. Meron namang cold agglutinin. So, ma'am, what is cold agglutinins? So, some people, guys, have immunologic disorder wherein at body temperature, walang agglutinins. Yan, walang pagkaklat ng dugo. However, when their blood was extracted, and it remains on a room temperature or a cold temperature, there are microagglutinations that happen. So what could be the effect of that? Yan, it could decrease your red blood cell count kasi nga nag-clot na, and it could make your hematocrit inaccurate. So the solution is pre-warm the blood at 37 para mawala yung agglutinates. Ito, I told you, nucleated RBCs could be falsely read by the machine as increased WBC. So what could we do is calculate the correct WBC count. What if you have giant platelets? Yan. Ang effect nito, bababa yung platelet mo, and it could increase as, it could be read as your RBC. Yan. So, how to resolve this? Examine your blood film, or instead of using EDTA, kasi ang EDTA nagkakos ng platelet satellitism, you could recollect using sodium citrate. Or use manual counts. Yan. Madali lang naman mag-platelet estimate sa smear. What if there is lipemia? Just what I said. Yan. So, follow manufacturer's instruction daw. Hemolysis. Yan. Recollect ang solusyon. Old specimen, recollect pa rin. If there are poikilocytosis, yan, do a manual differential count. Check the peripheral blood smear. What if there are red blood cells which are resistant to lysing? Kasi nga yung cyan, hemoglobin, para ma-measure mo yun, kailangan mo i-lyse. Yan. So, you would be the one who will manually lyse the red blood cells. If there are fragile WBCs, yan, do manual counts. So, for the hematology analyzer, may flags. Yan. May sign kanina, may H for high, L for low. Yan. So, may flags naman to help you investigate if there are abnormalities in the blood. And meron tayong mean. Yan. So, the analyzer would get the average MCV, MCH, and MCHC. And kukulin niya yung mean. Tapos, we'll assess the standard deviation, the coefficient variation. We'll use statistical tools. Baka may mga na-run tayo which are really abnormal. And perform delta check. Delta check, huwag niyo kalimutan, comparing the current results to the previous results of the patients. Okay? And finally, guys, we have stain. Okay? So, depending on the frequency on how you use stains, example, right stain ang madalas na ginagamit sa peripheral blood smear. So, depende but what we do every day is we filter out the stain kasi minsan may mga residues, contaminant during the day. Sometimes we replace, depending on the number of patients talaga. Pero yun, replace your stains if the stains doesn't look good anymore. And usually what we check at the eosinophil kung okay pa yung pH ng ng stain mo, you could see it sa eosinophil. Kung yung granules niya may pagka reddish orange, okay pa yung stain mo. Kung hindi na okay yung granules ng eosinophil, replace your right stain already. So guys, thank you for listening. I'll see you again. Bye-bye.